Hello, everyone. I'm so glad to be able to present to you today about music therapy in the NICU. My name is Ruth Eliason, and I'm a music therapist here at JPCH, and I am coming to you from a hot, sunny day in August. So, whenever it is that you're listening to this, I hope that you're somewhere comfortable, maybe with something to eat or something to drink, and we'll take about half an hour to learn. Um, I have been working at JPCH since 2018 in Peds, but starting in the fall, we'll be offering music therapy services in the NICU for starting with about 6 hours a week. And so I'm excited about how that is going to unfold, and it seems right because fall is kind of a time of new beginnings. So I'm very excited to be joining the team there. I just wanted to start with a little bit about me. I had mentioned working at pediatrics at RUH and then here at JPCH. And prior to that, I worked as a music therapist at St. Paul's Hospital for 15 years in the palliative care unit. I've got 4 daughters. They're 8, 10, 12, and 14. And I like to read, garden, paddle, and sew in my free time. So that's just a little bit about me, and I'm coming to you here from the Child Life Zone in the hospital. So that's where I will spend. That's where I spend a good bit of my time when I'm at work here. So, looking at music therapy in the NICU, I wanted to go over, look a little bit at the research, the rationale, and the outcomes, so that there's a bit more understanding about why music with premature infants and what we can expect to see when we work with them. So there's over 30 years of research has shown that music therapy has positive effects on social, emotional, communication, behavioral, neurological, and physical development. So I feel very fortunate that we have a really strong body of research for NICU music therapy that really informs what the protocols are for each kind of particular age and time of development. So there's really strong research there. And I did my training with Jane Stanley at the Florida State University, and she is kind of a pioneer in lots of the NICU music therapy work. So I felt very fortunate to be able to learn from her and to continue to follow how new research is emerging as well, that will probably lead to some exciting things as well. So music therapy sessions in the NICU could include gentle lullaby style singing, guitar music, touch, recording parents' voices, and personalized lullaby writing. So that's just a little bit of a quick overview. And then we're really looking at the neurologic basis for utilizing music therapy in the NICU. In the third trimester, the premature infant is developing over 250,000 neurons per minute. So any lack or change of developmentally appropriate stimulation will contribute to developmental delay. We know that. And music is the only stimulus that floods both hemispheres of the brain simultaneously, which facilitates positive growth and connections in the corpus callosum. So if we look at, lots of the imaging that's available today with MRIs or functional MRIs even, but they see that for people who have engaged in music making, like musicians, their corpus callosum is larger. So it actually does cause growth. And so we know that music at this crucial time of development for babies who are missing some or much of that third trimester can really help in that neurodevelopment. Hearing is one of the first senses to develop. From about 28 gestational weeks, the fetus in the womb is hearing the mother's voice at only 15 decibels attenuation. And so developing receptive language concepts, a connection to that maternal voice, can be a very important part of the music therapy work. So when that's interrupted by premature birth, we look at ways how can we, um, in a safe way, offer that stimulation that can help continue the growth and development. I'm going to take a look at the benefits of NICU music therapy for premature infants. I'm just going to list them, and I will include a table in a separate attachment that goes through these different benefits, and it'll cite the studies that correspond to that. So for here, I will just list them so we don't get bogged down with all the citations. But um, music therapy improves oxygen saturation levels for babies, and sometimes that can even be an immediate effect on hearing the music, stabilizing heart rate and respiration rate, shortening hospital stay on average of 5 to 10 days. And the training, as I mentioned, is in the States, and this one, I think probably for any healthcare provider, but this one really speaks loudly to hospital administrators in the States where they're dealing with separate insurance providers. So anything that can alter and shorten that length of stay speaks really loudly. But increases weight gain, reduces overstimulation and hypersensitivity while increasing neurologic development, reducing stress after painful procedures like blood work or eye exam or those sorts of things can be a way to self-regulate and kind of return to a calm state. And it provides developmentally appropriate stimulation for neurologic development. So many benefits that we have the evidence to speak to, but also that we know from babies and caregivers over time, the use of lullabies, infant-directed speech to connect to babies to help them learn language, rocking, getting that vestibular input. All of these things are used in our
race outreach 6100.
Sorry about that. All of these things have been part of the care for infants, across cultures and for so many years. So we know that music is powerful. So it's been great to dig into the why and the how. So when we look at the expansion of music therapy services, looking at altering the protocols for accommodating gender differences in response to music paired with touch. So mostly this applies to the male infants in that they, just in how they function or do as premature infants, the stimulation is kind of adjusted to be a little bit simpler and less alerting when providing music for young male infants. Positioning during music to facilitate blood flow to the brain, or even different positioning to facilitate facial focus for visual communication. New areas of research looking at music listening to increase respirator independence for infants who are ventilated. Music listening for stability of vitals in micropreemies. And music to teach developmental milestones to long-term NICU patients.
Attention, race.
So from the really young to some of the older babies who are looking to work on their developmental kind of milestones or need additional support and stimulation based on their age. There's something that is a good fit for all of them. So what we know, positive sounds are critical for language development. When looking at the sound environment, the open bays of maybe other NICUs or in the past have their challenges of um, being stressful and overstimulating with not infant-directed sounds. Um, and then on the other side of the spectrum, uh, risks that come from not enough stimulation to sound. So what we want to do is look at the sound environment and create a healing environment that includes opportunities for infant-directed speech through recording or sung music. So also noting that quiet promotes sleep patterns, protects fragile hearing, and organizes sensory processing, and that music reduces stress levels, which affect blood pressure, heart rate, respiratory rate, and oxygen saturation. So when we think about what babies need, um, these are some of the goals for NICU patients, and obviously they'd be individualized and based on the age, um, the what's going on medically for the infant, and what the team identifies as being areas needing support or areas to work on. But some of the goals for NICU patients include soothing and containment. So that can be, with physical touch and positioning or through music as well. Positive auditory experiences, supported maternal sound environment, so bringing that mother's voice into the baby's auditory world. Improved oxygen levels, get them off of any oxygen and breathing well on their own. Self-regulation, to be able to do that is another important skill to promote communication and early brain development. A family-centered approach to include the whole family, to reduce trauma of hospitalization, for procedural support, and often that will look like the provision of music therapy following a stressful event, like an eye exam or any aspect of care that is stressful for the babies. Parent education, supporting and empowering the parents with how to care for their infants as much as possible, and including them in the care, in making choice and agency, and also to promote and support bonding time. Um, so these are all goals that can be addressed through music therapy treatment. And I just wanted to move on to referrals and criteria. So this is a little bit more of the practical information that can kind of inform how music therapy would work. So if reasons for referral, if the patient requires a meaningful acoustic input and a positive maternal sound environment, so for those mothers or family that aren't able to be with the patient as much as they would like, there can be bringing that maternal voice into the baby's sound environment through recordings. If the patient requires assistance with self-regulation, easily disorganized or very irritable, patient has a low tolerance to stimulation, or if the patient requires developmental enhancement due to prolonged hospitalization, or if there are parents who are wary of or having difficulty interacting with their infant, for a patient who is at least 10 days old with a weight greater than 1,700 grams. And so for those babies 28 weeks postmenstrual age and older, it could be a referral for music and kangaroo care, vocal containment like live music listening, interventions, and family support. And for those infants who are a little bit older, 32 weeks and older, who are ready for minimal stimulation and especially those having trouble with sensory integration. So these are some of the reasons to say, maybe this family or this infant could benefit from music therapy. So I just want to move to the live music listening, or you also could call it vocal containment. Um, and I think the reason why live music is so powerful is that it allows for adjusting the tempo or other parameters if the infant is showing signs of overstimulation. As well, it can be really customized to fit the infant or the family, or to support their culture or their language. So for younger babies, younger than 28 weeks postmenstrual age, a cappella music is the best. So just sung with the voice. For older babies, they can handle the voice with simple guitar accompaniment. And the music is constant and not alerting. So that means no syncopated rhythms or fancy key changes or interesting chords. It's just very simple and calming. Uh, a variety of selections is good, and lullabies of all cultures, especially in the language of the parent. So different from white noise or mobiles, different from that kind of music. And uh, the mother's voice, sung live or recorded, is beneficial for the live music listening for the infant. Just increasing that bonding and providing that role for the mother in the care of the infant. And also, caregivers are encouraged to participate by singing or working with the music therapist to create a customized lullaby. So, um, this this has been an interesting and special part of my work when I've had the chance to write a song with a family. I've kind of pitched it as kind of like a hug with music, or what is it that you would like to say to your infant that you want them to know. Um, and so it really is beautiful, the kind of unique and individual things that come out of that process. So, and we know that lots of times the music that the babies are and families are using in hospital is what they carry with them when they're discharged. So it can be a important part of their their care and their continued growth as they return home. When looking at recording music, recorded music of the mother's voice is very powerful in, as I mentioned, like increasing bonding and connection between the infant and the mother. Um, so presentation would be alternating 30 minutes of music with 30 minutes of silence for no longer than 4 hours per day total. So just making sure that the infant has that rest time of silence, just so that they can attend to the music when it is there. Um, and of course, the volume, the decibel level is very important. So using a decibel meter, less than 45 decibels for loudness, and using the C scale. So that's going to be pitched probably a little bit higher than um, most people's speaking voice, but it is the scale that's best suited for the infants. And the placement of the speakers for um, being able to hear and attend to the music on both sides is beneficial as well. Um, the use of recorded music and live music listening as provided by family has been seen to increase presence at bedside for family. So I think it's powerful. It speaks to the power of an invitation and empowerment in providing care for the infant. Next, we'll look at multimodal neurologic stimulation. So that's MNE. So this is a systematic layering of developmentally appropriate sensory input. So a gradual and layered way to expose the infant to stimulation that is supportive of their learning and growth. So the goal is to promote homeostasis, increase tolerance to developmentally appropriate sensory integration, to promote self-regulation, decrease stress and hyperactivity, and promote parent and infant bonding. So, so this is, I guess maybe I'll speak to a bit of the criteria here. The infant is at least 32 weeks postmenstrual age. Happens ideally 30 minutes before care, so looking to bundle that, but also that would be the ideal time to offer it. So it starts with layering vocal music, beginning with humming, really simple and soft, then progressing to singing, adding words, and then adding tactile stimulation. So it's cephalocaudal and proximal distal. So working from the top down and inside out, just providing gentle touch in a kind of directional way. Then adding rocking to that for the vestibular input as the infant allows. So in all of this, if the infant is showing signs of overstimulation, finger splay, red face, or hold hands, any of those things, then you just go back and reduce a layer of stimulation. So in the research with the MNE, positive results are seen in heart rate, oxygen saturation, state regulation, length of stay, as well as increased parent bonding and decreased stress. So this is another one of those things that parents can be educated on how to provide it, knowing that they're offering something that is really beneficial to their infant, and it's a way to provide care that supports them. And focusing a bit more on parent care and support, we know that having a child in the NICU is most often an unexpected thing, a huge stressor with unknowns about the baby's health or development or the future implications, as well as financial strains, um, strains on time demands, perhaps of other family, or over distance with travel, can be incredibly stressful. So music therapy can be one way to support family members in dealing with that stress. Whether it's education and training in music assisted relaxation and visualization for self-care, or even for looking at relaxation for breast milk expression and pumping, as well as providing education on ways to support infant development after their child is discharged too. So that just kind of speaks to helping parents feel empowered and as agents in being able to care for their babies, both during their stay in hospital and beyond. Want to touch a little bit on legacy and bereavement work. Um, from a music therapy perspective, this can be identifying meaningful songs, um, can be for music listening, memory making through heartbeat recordings, where the infant's heartbeat is recorded, and then you just loop it and then add, whether it's instrumental music or a composed song, to accompany it as a keepsake and a legacy piece that families find meaningful. And it could be songwriting to accompany that. I know a few cases of songs that I've had a chance to write with patients or family members, of little ones who have passed away. The song has been really special to them, and they've kind of included it in some of their remembering and memorial times for their infant. Music therapy during compassionate extubations, for a life-limiting diagnosis or demise, creating positive memories. Sometimes it's just bringing a little bit of joy and and maybe weaving in some music that has family ties, or music during rituals or religious ceremonies. So lots of different ways to be able to support families around this time of, you know, a life limiting diagnosis or a loss. Um, and then just moving on to NICU music therapy approaches. So looking at patient and family centered care that is our focus in the health region, wanting to really collaborate with family members in a way to empower them, sharing information, working with their strengths, starting with a foundation of respect and recognizing diversity, that each family is different and unique, and we may know some things about them, but there's lots yet to discover um, in who they are and what that means for working together in the care of the patients. So in developmental care in the NICU focuses on protected sleep, looking at pain and stress, how to assess and recognize and manage that, um, looking for developmental ADLs, how can we support the babies to be able to meet those, as well as looking at the family as being a very important part of care and creating a healing environment. So for music therapy, that could mean like how can we utilize the services at a time that is optimal for the infant and their development. So it could mean bringing in the services right after the stressful procedure, or it could mean, let's say, I need to work with the infant now. Let's see if we can also provide some other services at that same time so that they can still have their rest. So, and then the third, trauma informed care, recognizing that the many family members have been through something traumatic, even in the path of their infant coming under the care of the NICU. So recognizing that, as well as the wider trauma, recognizing the signs and impacts of that, um, taking care not to re-traumatize people, as well as making an effort to um, create an environment of collaboration and safety and trust for people to be able to mitigate some of those effects of trauma. So those are three of the things that I think about when looking at how to deliver services and how to try to integrate care. So um, I'm coming to the end of my time here, and I'm so grateful for the chance uh, to speak to you. And I will include, I'll just flip to the references and resources. So this is just a few things that I put up, but will put up my contact information, as well as that more expansive list of references and resources that I mentioned, that kind of pairs with some of the specific protocols in case anybody's interested in looking at that. And I encourage you to look online too. There's lots of lovely videos of music therapy with NICU babies. And I will say that in the States, they have a PAL system, which is a pacifier activated lullaby system with contingent music. So working with operant conditioning with the infant. So when they suck a pacifier, working to strengthen non-nutritive sucking, they'll suck the pacifier and then it'll activate recorded music, and it can be adjusted for frequency and pressure of sucking. So it can really um, encourage them to work on those skills needed for oral feeding. But unfortunately, that's not FDA approved here in Canada just yet. So maybe that's another Ed Day presentation in the future if that happens. But yeah, thank you again so much. I look forward to working with you in the fall, and I appreciate the time. Thank you.